and welcome to the AMSA podcast series, where we bring you to the latest insight from the world of medicine. And today, I'm Ummu bin Rosli, will be your host for today's session. So in this episode, we'll be delving deep within the topic that involves all of us, whether we recognize it or realize it or not: skin infections. And with us, we'll be separating facts from fiction with the guidance of our two distinguished guests here today, which is our first distinguished guest, Dr. Salamah binti Faisal, a microbiology lecturer and clinical microbiologist at University Pertahanan Nasional Malaysia. She's actively involved in health and academic initiatives, including organizing awareness campaigns on antimicrobial resistance and hand hygiene, with a particular focus on clinical microbiology. And our second distinguished guest, Dr. Aiman binti Faisal, a clinical lecturer and consultant dermatologist from University Science Islam Malaysia. She is a consultant dermatologist known for her active involvement in both health and academic initiatives in the field of clinical dermatology. So today, we'll explore the A to Z, the cutaneous skin infections, clarify common misconceptions, and equip you with knowledge that could help in both clinical practice and daily life. So let's get started. So before we get started, let us try to get to know our guests for today, their backgrounds, their biodata. So, Dr. Salamah, could you start by telling us a bit about your background and your area of focus in microbiology?
Assalamualaikum warahmatullahi wabarakatuh. I'm Dr. Salamah binti Faisal. A little bit background about me is, I was born in KL. I'm a mother of 3 children, 3 beautiful daughters. Currently working as a medical lecturer, and also I'm serving as a clinical microbiologist in Hospital Angkatan Tentera Tunku Rizal. So we are doing simultaneously 2 jobs, but actually it's not that hard because it's actually part of bread and butter as a medical doctor. And then my husband is also a medical doctor. He's an orthopedic surgeon working in Hospital Muar. So currently I'm juggling as a not a single lah, tapi working mother, handling 3 children, and at the same time doing my service. So regarding my job, my job specifically focusing on studying since as a microbiologist, but specifically as you mentioned earlier, my area of interest is in antimicrobial stewardship, and I'm focusing on, I'm working as a frontline in infectious disease, learning and studying how specifically bacteria evolve, how they develop resistance towards human body, and how do we as a human we can fight them and treat basically the infection in our body.
But thank you very much to Salamah for the brief background regarding your work. Must be quite interesting regarding trying to find out what are the small things in life that can actually affect our daily life.
Yes.
So now I would like to move on to second guest, Dr. Aiman. Could you give us a brief introduction and background on who you are and what does it mean to become a dermatologist?
Alright, okay. So where do I look? Alright, okay. So my name is Dr. Aiman. So I'm as you can see, our names similar, so we are actually sisters. So I'm married with 1 child, and I'm a clinical lecturer and also a clinical dermatologist in University Science Islam Malaysia. So I'm both academician and also clinical doctors. So you mentioned about what do the dermatologists do. So I think people know skin doctors. So basically, dermatologist is basically a skin doctors that specialize in mainly skin disease. Sometimes people misunderstood us just aesthetic. So in dermatology, it's not just aesthetic cosmetic dermatology. It's a small part of dermatology, but what I deal mainly with is mainly clinical dermatology, which is a disease skin. So yeah.
Very interesting. I heard a lot about like skin infections that we're trying to find out. So today I think we can bring more deep within for our guests and also for the interview for the viewers to know more about skin infections from our own distinguished guests here. So let us start for our first segment, which is an overview of cutaneous skin infection. I would like to ask Dr. Ummu Aiman. So let's start with the basics. What exactly qualifies as a cutaneous infection?
Okay. So to say what qualifies sound really big, just to make it simple, it's very important for you to differentiate between infection and colonization. Okay, because you know that we talk about skin generally, and you know that our skin has about 1,000 microbiota on the surface of the skin. Some of them are our friends, some of them are also our enemies, our foes, and the important thing is to have the balance, right? So sometimes you're gonna get a colony of some species, means that they are more than usual, but that doesn't mean that it equates to infection. So infection means that the bacteria or the pathogen or the microorganism has, invades the immune host system, go inside and cause an immune reaction. So the moment you see that immune reaction, then you would, sort of like put it under infection. Yeah.
So
if that is say it is an infection, but what causes infection can be many things, whether it can be viral, it can be bacterial, it can be fungus, it can be a yeast, all sort of microorganisms that on your skin has a possibility of inducing an infection.
yes, so it's quite a complex, we can say, ecosystem on the skin itself that influence between our own body reaction and their reactions ourselves. So I would like to ask from a microbiome standpoint, like how does this affect our daily life, and from a microbiome standpoint, how do we see a skin infection?
So microbiologist, let's get microbiologist. Dia macam ni, to make it more microbiologist to layman point of view, I akan cakap in Malay sikit lah, senang sikit nak bagi faham. So microbiology terlalu lab sangat. So when we talk about skin infection, it's like a pathogen. Pathogen ni as in virus, macam like Dr. Ummu has mentioned, virus, bacteria or fungus break into your normal physical barrier, skin barrier. Macam barrier as in you have your macam pagar lah. Your skin ni macam satu pagar. So bila ada pathogen break the barrier, dah breach the skin barrier, and then dah breach, and then they multiply and start induce your immune response, because as a human you ada normal immune response, invade and start induce your immune response, then kita panggil skin infection. So kalau colonization tu just bacteria tumpang duduk sahaja without causing any significant immune reaction, then yang tu kita tak panggil dia skin infection lah. So nanti after that, because you need to know these two different things, because nanti usually dalam kita punya skin ni pun kita ada apa, macam kalau kata kita panggil dia ekosistem kan, the good bacteria, bad bacteria. So jadi bila the bad bacteria ni dah kacau juga the good bacteria, then it will still lead a significant skin infection. So jadi nak fahamnya, how do I translate, is like when the skin barrier has been breached, the bacteria and the pathogen multiply and then cause significant immune reaction to your body, then it is a skin infection lah. Yes.
So, you mentioned earlier for like the mechanism of defense of our skin. So when do we know when does this skin barrier fails? So that it allows us that those bad pathogens attacking us. So when do we do that?
So I get it.
Okay. You mentioned before kita nak tahu how do we know that the pathogen has invaded.
Yes.
We have to understand about our skin barrier first. When you talk about skin barrier, skin is more complex than just a pagar barrier. We wanted to see, the real skin barrier classification. We can divide into physical barrier So physical barrier is the one that how your keratinocyte, your skin cells is arranged in a pack like we like to compare dengan batu-bata, the skin cell as the batu and the lipid bilayer as the cement in between the batu-bata. So that is the common bila orang kata skin barrier, orang akan bayangkan, and that is only physical barrier. And physical barrier is very important because like macam kalau dekat rumah kan, kalau you ada lots of holes in between, then you're gonna get a lot of benda luar masuk dekat dalam rumah. Yes, so that is the first barrier, physical barrier. The second barrier is your microbial barrier. Okay, so your microbiota on the skin also act as a barrier. So remember the ecosystem just now. So if you have overgrowth, if you suppress one species, it might lead to overgrowth of another species. So the species yang sebelum ni mungkin harmless, but bila dia banyak, then it can cause a reaction. So that's why it's very important to have that balance, the ecosystem. Everyone kena duduk dalam number yang sepatutnya. Like macam kita belajar biology di sekolah, mendengar dulu, you talk about ecosystems of our body and everything, and this is simple analogy. You suppress one species, then you're going to get overpopulation of a different species, Okay. So that is the second barrier, which is your microbial barrier. Then the third barrier is your pH. We call it as a chemical barrier. Our skin is slightly on the acidic pH. And this is very, very important because it needs this acidic environment is important to maintain some of the function of the enzyme in the skin. And if your skin gets too alkali, then certain enzyme are going to be more active, then they can cleave this protein yang attached to the that cantik macam batu-batu tu satu. Another thing is bila your skin is too alkali, you're gonna get promotion of more certain pathogenic bacteria, for example like Staphylococcus aureus. So that's why the third barrier is chemical barrier, and the chemical barrier should be maintained at slightly acidic environment. About pH about 3.5 to 5.5 like that. Okay, so that is one thing. And last but not least is our immune barrier. Okay, so immune barrier is the one that you have your innate and adaptive immunity, and skin is your first line of defense. Okay, you have your Langerhans cells there that act as an antigen presenting cells, and these Langerhans cells actually come from your bone marrow and then populate your skin. And they act like your first, since kita dekat Aiman, first askar yang dekat depan. Okay, so these are the one askar yang nampak any bacteria or any antigen yang is not norm to the area, they akan catch it and present it to a more sophisticated cells to initiate the immune reaction. So if you have to understand that these are the four barriers first, and in order for the organism to initiate an immune reaction, they have to pass through this four barrier. All these four has to fail. So so in order and how do you know that immune reaction is there already? It's the clinical sign of inflammation. You're gonna see the redness, you're gonna see the swelling, you're gonna have pain, and some you're gonna get exudate and everything. Yeah.
Very interesting because it really shows regarding the complex creation of our own skin cells. Because a lot of us from viewers, I think in the layman term, they only think about when we have a scratch, that what starts the infection. But actually, there's a lot more happening, like very small regarding our cells itself and our own immune body that reacts to it. So that's quite interesting. Thank you so much, Doctor, for trying to explain us in layman terms and make it easier for our viewers to understand regarding what actually happened. It's not just a scratch on the skin itself. There's more to it. There's more layers to it. Okay. Now, Dr. Ummu, you mentioned about rashes, inflammation signs, which are some of the rashes. So, I think a lot of our viewers here have already once in their life experienced rashes, and one of their most biggest concern might be, how do we know if it's infectious or not? How do we know if rashes are dangerous, or will it just go by itself?
Okay, all right. So, because red swelling can also be a sign of inflammation. and not all inflammation is due to infection. So there are few clues that can point to whether this infection as a cause. Okay, so one, if clinically on the skin, if you see, you're gonna see some yellowish material, call it some. You can have this very characteristic we call as a golden crust, honey crusted area. Okay, so that it gives you a clue that you might be dealing with the bacteria, especially Staphylococcus strep. And if you have fever, fever is also more points toward direction of infection. But generally, because pain also would also slightly push toward infection. But there are also certain condition that is not due to infection, but you still can have skin pain. So that's why pain and age is very it's not really specific to say that it is 100% infection. Yeah.
So that's how we try to distinguish from the colors of the appearance and
appearance. And history.
Fever.
Yeah.
One of the biggest important things that we need to distinguish from this type of rashes. So aside from that, that's from the standpoint of like trying to look at it from a previous ones. So from my side, is there anything from a person that could do to like protect themselves from this type of rashes? Is there any sort of antibiotics or creams?
Okay. So basically, maksudnya nak tanya from skin infection, how do we can so kita nak prevent the skin. Okay, so jadi basically macam ni. Kita punya skin, like we have discussed just now, is an ecosystem. You treat it like a green forest. So basically, you just have to maintain maintain a healthy barrier, maintain the integrity of the physical barrier. So jadi basically, one thing as a microbiologist I nak pesan, just don't over sanitize your skin. Yes, maksudnya because like like Dr. Ummu has mentioned just now, these four important barriers that you gonna maintain. There's a physical, chemical, the pH, and then immune system, immune barrier. The immune barrier tu maksudnya datang daripada dalam diri, your gene, genetic. So that thing you susah lah nak control daripada luar because you are born with it. So you ada autoimmune disease, then you cannot control how will your body react to certain of the environmental stresses. So jadi tapi kalau kita as a living human, what you can do, just don't over sanitize your skin because you macam like I mentioned just now, we have good bacteria and bad bacteria. You nak maintain the good bacteria in a very good proposition, kan? You tak nak because bila you over sanitize, you overdo your terlalu mencuci tangan, because once nama dia bacteria, of course dia akan sensitive, dia akan be killed by all this kita panggil komponen dalam the sanitizer. So jadi despite they are good bacteria, walaupun tujuan you konon-konon untuk membunuh lah, quote, ada bad bacteria dekat skin, you overdo it, then you kill the good bacteria. So indirectly dia akan mengurangkan the integrity of the skin barrier. So jadi itu akan start, it will contribute as a macam risk factor untuk start all the macam suddenly macam rashes ke apa ke macam tu lah.
I just know that actually because of I'm pretty sure I've also am someone that sometimes wash my hands more than 3 times a day because of touching.
3 times a day is okay.
No, actually
you have to wash at least before.
okay.
At least before you eat, you have to wash your hands.
But every time because I'm also a medical student, so whenever I'm with a patient, touch a patient, I always over sanitize my hands.
Yeah, it's a medical student syndrome. Dia dah ni ke cuci lagi? Yes.
So it always been a criticism because of I thought that the more the better. But apparently we need to be cautious regarding the ecosystem itself.
So as doctors or healthcare workers, you have to, after seeing a patient, clean your hands. That is very important. Just want to prevent cross infection. Okay? So that's also make us healthcare workers as one of the high risk group who dapat skin irritation because of the frequent viral. You know, you wash your hand, you wash with chloroxide soap, and then wash it with alcohol rub and everything. But that is one thing yang we face as a healthcare worker. But we have to do that because if you don't wash your hand every time you see one patient to another patient, then there is always a risk of bringing the infection from other patient to other patient. Your cross infection. Okay, but we were talking generally about layman who is not working in the hospital. Just at home ataupun student biasa ke tak masuk dalam ward and everything, not in a high risk environment. So it's very frequent hand washing also predispose your skin to your skin barrier to get disrupted, and then you're gonna get lots of irritant effect. You start to have dry skin, and then if you are eczema prone, you can get eczema disruption. And remember, we talked about the skin barrier, importance of the skin barrier. So when the skin barrier is already disrupted, then you are more prone to get infection. That's the thing. It's just that everything has to be balanced. Before you eat, you still have to wash your hand. After you go to toilet, you still have to wash your hand. But we are talking about in a lower risk environment. You don't have to like sitting around and suddenly ambil sitting around kan macam tu lah. Okay, but if you have to do it, I mean, if you work in a hospital, then you have to do it.
Yes, it's right. You wash hand accordingly. Maksudnya kan kita kalau ke hospital, like what I've been advocating in my awareness campaign, hand hygiene, there are 5 moments yang you memang kena basuh tangan, proper hand hygiene. That is memang a different story, macam no compromise. Before seeing patient, after seeing patient, after procedure, before procedure, and after memang you dah clearly your hand is contaminated. Definitely. Sebab tu kalau dekat hospital pun you can see every footbed memang ada sanitizer kan. Kalau tak ada sinki, then you ada sanitizer. Tapi as a layman, maknanya macam bila kita balik kampung, macam you just pergi makan mana-mana, pergi minum kopi ke mana-mana, macam like what Dr. Mu said, don't just suddenly tiba teringat rasa nak ambil awak kan. It's like unnecessarily over sanitize. Tapi kalau dekat, because kita tahu kita kalau kat hospital, kita sendiri memang in a high risk population, you tak nak being infected, and at the same time you tak nak carry the germ to your patient, then you akan basuh tangan accordingly. Macam itulah, because kita macam before you nak jaga orang, you jaga diri kan. You tak nak bawa the germs to other people.
Tapi kalau seorang investigation, ramai-ramai patient semua sama kena.
Yeah.
Alright, thank you very much regarding explaining that. Because I'm pretty sure most of us have once experience regarding like washing our hands quite a lot.
Yes.
So for the layman people, how many times do they need to wash their hands? And is it important that they wash their hands with sanitizer, or just soap is enough already?
Alright, so what I advise my patient is, okay, when you use soap, especially those with fragrance and some way, it's gonna dry out your skin. Okay, so if you really need the soap because, for example, your hand is very oily, then you can use the soap. But if you just, before you want to eat and your hand is not visibly very dirty, just wash with water thoroughly. Okay, just wash with water thoroughly. And if you really need to use a soap, make sure you wash off the soap thoroughly. Okay, and after that, moisturize your skin.
Moisturize?
Yes, you have to
Actually, a lot of
moisturize.
people miss that part.
Yeah, so you have to moisturize your skin. So before you eat, okay, you don't have to moisturize your skin after you wash your hand, then you can eat. But especially if you do wet work with soap, for example, you basuh pinggan or you basuh baju, So after you deal with the soap, remove all the soap, moisturize your skin. Okay, that's how you help with your skin barrier.
So
Yes.
for moisturizer, what kind of moisturizer, like for normal moisturizer that can use actually?
What normal moisturizer again? Okay, so moisturizer, I would always say the best moisturizer for you is the one that you can use frequently and in a liberal amount. Okay, so everyone would have a different best moisturizer for that. Some of ada certain orang they prefer a moisturizer yang sangat cepat absorb because you don't like the oily texture, then go for that moisturizer. Ada certain orang dia suka sangat this moisturizer is very good, cepat absorb, but it's too expensive, and because of that dia guna sikit saja, then that is also not a good moisturizer for that person. So the key is when you can use it frequently, liberal amount, and it doesn't hurt your pocket.
That's the last part. Need to be very cautious for that.
Yeah.
Alright. So as we both know that we live in Malaysia, very hot, humid country. Is there any type of common pathogen in Malaysia, as if I know the Ummu just got back to Germany, right? Right? So is that, from a tropical country, is there any common pathogen that we need to be aware of? Like, what is the most common in Malaysia?
Jadi basically kita nak cakap common pathogen tu dia tak adalah berbeza sangat. So sekarang ni pathogen ke apa, so sekarang ni for bakteria tu dia akan berbeza dari segi, because each bacteria dia punya local epidemiology dia sendiri. Jadi dia punya tropism, kenapa dia suka hidup kat that particular country ke apalah. But for untuk kita punya Malaysia ni kan macam suhu dia is a tropical punya kita panggil tropical country lah kan, climate. So basically sebenarnya dia nak tahu what are the common and the macam likely pathogen yang senang dijumpa kita, yang boleh senang nampak kat you punya patient. Sekarang kita nak tahu common adalah bila patient datang dekat you dapat dekat rasa positif, dan you collect the data, then you know okay, this is the highest reported pathogen. Basically I can relate dengan apa yang Dr. Ummu has mentioned earlier, yang all the barrier tu physical, how kita punya skin, the normal barrier of the skin, the factor yang panggil affecting the skin barrier, kita ada. So jadi basically population pathogen dia akan senang pergi dekat population yang high risk. So jadi high risk untuk climate ni adalah macam biasalah, sama je orang yang first yang immunocompromised, macam HIV, diabetes, and then another high risk adalah healthcare worker ke. Dan second is kalau yang high risk yang senang affected dengan pathogen dengan climate ni adalah yang macam sebab dia macam kita fungus ni dia senang duduk dekat tempat yang lembab-lembab kan, dan kita pun memang humid lembab juga. Jadi macam atlet ke, orang yang selalu berkerubung, itu pun high risk juga. So jadi basically tak adalah kata common pathogen, sama je still, because you punya normal flora adalah Staph epidermidis. Common pathogen yang dekat skin still remain Staph aureus. Mana itu memang textbook punya definition skin pathogen. And then you ada juga macam yang common cause yang untuk certain macam Shep viridin, Shep pyogen. Then you ada Vibrio vulnificus. Semua tu adalah basically pathogen yang commonly affected your skin infection lah. So jadi kalau untuk Malaysia nak relate dengan climate kita, basically kita pergi kepada high risk yang easily affect the physical, yang how dia punya physical barrier tu akan affected lah. Macam tu je lah. So what I can say common is still Staph aureus lah kan, sebagai common. Kalau virus ni benda lain, fungus pun lain. Maybe kalau ni kena tanya dermatologist yang selalu tengok.
No. I mean, just to share, because you have to, like my sister mentioned, that you have to imagine the skin. It's like the ecosystem, it's like the forest, certain area kalau dekat dengan sungai mungkin ada binatang, certain area yang more gunung daripada sea, that species more than the other. Not to say that yang lain tak ada langsung, but one species can be more than the other. So same like your skin, For example, if you have high sebaceous area, you're going to have more Cutibacterium, Cutibacterium species. So Cutibacteria, Malassezia, they love this sephoric rich area, because they feed on the sebum. Okay, so and over your reflection, it's a type of yeast. Malassezia is a type of yeast. Dia ada banyak Malassezia, purple Malassezia. There's a lot of other already yang lain, but it's the species Malassezia is a type of yeast. Okay, and if you're looking at your flections, you're gonna have a different type of bacteria. You're gonna have more Corynebacteria over there. you can still get malaria also, but and also your staph epidermidis generally everywhere in your body lah. But we are saying that certain area gonna have certain predominance of certain species depending on the microenvironment.
Yes.
Okay, and then macam dekat kaki, you can see aspergillus,
Different types of
yes. So
Fungus.
so it's not about satu country apa yang ada. I mean, your whole body is one whole country. You know, you have about more than 1,000 species in the skin. Yeah, like we talk about microorganisms. You are more bacteria than you have more bacteria gene than in your own gene.
Okay.
You are more bacteria than yourself. You know, but this is to say it's very difficult to say like apa satu bacteria yang banyak dekat sini. You know, it's an ecosystem. So of course, the one that we say pathogen, the one that we want to have more is Staph aureus. You know. But sometimes even not a pathogen, for example, malassezia is not really a pathogen, it's the skin microbiota, but if the environment favors the growth, they become overgrowth than it should be, then it's still going to cause some problem.
Because now where one needs to be advantage.
Yeah, so the important thing is that.
So just like what you have learned in medical school, macam kita tahu your head and neck. Soalnya paling common pathogen dia macam sharp removal, because situ dekat you punya ni nose ada normal pathogen, normal flora yang lain. Kat your genital area you have a different normal flora kan. Macam your E. coli is your genital normal genital flora. In fact your candida sama, cuma kalau dia overgrowth you akan start nampak all the sign of infection. So different. In fact kita bahagikan okay, ni apa common pathogen, kat kaki apa, dekat your genital area apa, is a different thing lah. But basic je lah.
Quite interesting. Because we all, most of the laymen people, they would say that they think the skin itself is one whole thing. They didn't know that okay, at this area there's this type of microorganism, this area have more this type of microorganism, and maintaining the balance in the flora fauna itself is also a part regarding for our own health.
Yes.
So I think it's very interesting and something that we all should be more knowledge for and cautious because of it affects our daily life, right? So I think we can move towards our next segment. Our next segment will be common myth versus facts. So now we move towards the part where all our audience love to do, which is busting myths. So in front of us we have the whiteboards that the guests can say whether or not it is a myth or is it actually a fact? Alright, so let's go for our first question. Right.
Nak tulis jawapan kat sini.
Yes. So kita kena kita tutup.
Okay.
Okay.
Nak tiru kan?
Tak boleh.
Jadi beri suka tiru my sister.
Okay. So, first question, ready?
Okay.
Right. If you sweat and immediately bathe, is it true that you get tinea or what we call panau?
So maksudnya I tulis yes or not ke apa, myth or
Is it a myth? It's actually a fact.
okay.
Right, ready? You ready? Okay, 3, 2, 1. It's a myth.
No, it's a net.
It's actually a myth because I heard from my mother to my grandmother to even my teachers, they say, habis je pergi main bola, jangan mandi lagi. Tunggu kering dulu baru mandi.
Yes. So from a dermatologist's point of view, for those child yang ada atopic prone skin, eczema prone skin, kita memang advise because your sweat can act as an irritant. And in these child yang, I mean, tak kisahlah budak pun orang besar pun, those yang I mean eczema prone skin, if the skin barrier memang tak normal, it's genetically coded like that. So when your skin barrier is not normal and sweat can act as an irritant, sweat can actually triggers the itch reaction. Then you're going to start to scratch and everything. Then you're going to get a new eczema patch there, and your skin barrier damage there. You are at risk of getting secondary infection like that. So our advice will always be lepas main ataupun lepas buat aktiviti yang ada perlu, remove your sweat. Remove your sweat can be just with a dry and not dry wet towels ke, remove the sweat, buangkan sweat tu, and after that moisturize. So yeah, no, is mandi lepas berpeluh tak sebab yeah, tak sebab. So but if you mandi lepas peluh, mandi and then you biar lembab, that's different. Yeah.
That's a different thing. So it's not true yang ini our mothers or grandmothers told us, jangan mandi, jangan mandi. It's just not like that. I think
You have to remove the sweat.
just remove the sweat. Because the sweat itself can cause those infections.
The sweat can initiate an reaction because sweat can act as an irritant. That's why sometimes when you sweat a lot, those yang sensitive skin are gonna scratch sweat. Because sweat is an irritant. So if you don't remove the irritant, you're gonna scratch and you're gonna further damage your skin barrier, and that's when you're predisposed to get right.
Atau kering kat badan bawah kipas angin pun.
Yeah.
Keringnya sweat.
Okay, but you have to remove the sweat.
Right. Okay. So now we go towards the second myth or fact. Okay, ready?
Water kan?
Yes. So rainwater causes skin infection.
Rainwater.
Yes.
This is my first time hearing it.
Limit.
Alright, ready? Okay. 3, 2, 1. So it is a myth. So then that comes to the question: what kind of water can actually become infection? It can cause infection.
Okay, it's not the water fault. It's actually the environment of moist environment. Okay, for example, you are kita dekat ni tentera kan, you wear a boots and then you sweat a lot, especially for example ada orang, certain orang dia memang sweat a lot kaki and everything, and because of that your socks is sweat most of the time moist, and then you're gonna get an easy infection. So it's not because of the water fault, it's because of the moist environment that cause your skin to be macerated, promote certain yeast growth, and then you can get a infection. Water is not here. But again, macam for example, kalau kita cakap mandi sungai boleh dapat air pimples and everything. That one, if you have a break skin and you mandi dekat contaminated water, then of course you have problems lah. So contaminated water can be many things. Boleh jadi air hujan tapur masuk ada tikus lalu kencing dekat dalam tu, boleh jadi juga dalam air sungai besar tu dekat atas ada pengampung orang asli, dan they cook and everything, then you have lots of sakit. So it's not the water. It's not the water. Yeah, it depends on the contaminant of the area. Any water can get contaminated. And if you talk about yeast infection, moist environment that actually favor the growth.
This is my first time also with this.
Right. Nobody.
So now we move towards the third one. Okay, ready? So this myth is saying that garlic, toothpaste, and minyak gamat can actually cure fungus. Is it true?
Can actually cure fungus.
Yeah, fungus.
So you mean garlic can kill fungus? Is that the question? Garlic can kill fungus?
Either garlic, toothpaste, or minyak gamat, because they are told by our mothers or grandmothers sometimes, okay, nanti ada nampak ada any store skin infection, okay, taruhlah minyak gamat, taruhlah toothpaste, taruhlah all other things. So what are these things real? Okay, ready? 3, 2, 1.
So I go both. But then this one is still bad.
Okay.
Because there are some truths in there.
Alright.
Okay?
See, sama je macam.
Memang betul-betul sinting juga.
So, some truths, I think my sister also want to say, like,
Sebab dia macam, kalau dia cakap garlic can cure fungus, sebab sekarang ni kalau if you are talking about garlic as in garlic seketul tu, maybe it might be as an irritant untuk you punya, macam kalau just garlic tu saja, dia maybe not directly can cure. However, as a macam kalau kita kerja dekat lab apa, kita tahu kita ada bayi, dalam garlic tu we have an active component. So that certain active component, if we test in the lab, yes, it can kill some of the fungus. So jadi that particular active component tu yang usually kadang-kadang tu dalam laboratory kita akan ambil, and then kita boleh extract and process untuk jadi one of the active ingredient dalam kita punya medication. That is from what I know lah. Tapi as a garlic yourself seketul tu, you rarely boleh ni tak macam that is a myth lah from what I heard. Betul tak kan?
I mean, garlic has chemical component in it yang boleh act as a fungicide, but how they do that, they extract this and then do it in lab in the controlled environment and see how can it kills off the not virus, fungus, kill off fungus. Okay, but let's say if you have an infection, you don't know how much actually the fungus is there, kan? And then the species and everything, and using garlic itself without just in lab they extract the active ingredient that is helpful to kill off the fungus. But bila you guna garlic sahaja sendiri, the whole component, you are exposing your skin untuk dapat everything contact dengan
And then garlic tu beli kat pasar pula tu kan.
So there's more contaminated.
Yeah.
So the concept of kita semua bila kill off and everything, dia ada certain level, the therapeutic level. But when you just buat home remedies, you don't know what is the therapeutic level, what is the toxic level, betul tak? So it's quite risky to put that on skin lah. Okay. And different, baik tak lain lah kalau you dekat hutan kan, tapi because kita while waiting, you got no option actually lah. But if in the era of you boleh beli ubat antifungal sangat senang, more garlic.
And some more in garlic itself pun, selain that good component yang ada fungicidal activity, you also have other components yang who knows might cause further irritant dekat skin. So jadi selain daripada good fungicidal active component dalam garlic, you maybe ada komponen lain yang tak tahu maybe you allergic ke. So instead of curing, yes, definitely. So kita tak nak.
Same concept.
Yes.
Same concept.
Basically maybe lah orang dulu dia orang tengok orang seorang pakai okey, ataupun maybe dia tengok minyak gamat tu pakai dekat ni okey. Maybe that is how they learn, because they don't have any access to the laboratory ke apa kan. So jadi kita pun belajar dari orang why they thought things like that work. So maybe kita ambil and then kita proofkan, ambil extract the active component, yes it works, but that is in a control laboratory yes, macam you memang sterile, bersih semua kan. Tapi tidak tahu ada dalam contoh dalam minyak gamat tu ada komponen lain yang boleh induce ada reaction yang unwanted reaction yang kita tak nak kan. So jadi maybe if it works to some other people, it not necessarily will work for you unless it is proven by evidence based lah. This is have to macam medication over the counter sekarang, macam all the macam fungicidal cream semua tu, yang tu memang kita dah respect by evidence based, sudah proof dia punya concentration berapa, safe dengan skin punya komponen semua, then it is a different story lah. So jadi I think yes, untuk yang minyak gamat pun fact tu only on the active component, kalau you boleh extract yes. Tapi kalau sebab fungus ni, it's not just fungus. Kalau dia cakap fungus ni besar kan, dia punya payung dia ada setengah tu fungus, ada yang fungus yang betul-betul fungus yang kimia lain yang besar tu then definitely you tak boleh pakai minyak gamat lah kan.
I never heard about minyak gamat fungus. Generally minyak gamat is just in laboratory. If you have sometimes again, like if you suffer with their anti-inflammatory so you don't handle the infection, then it's gonna cause problem.
Especially when you can see clearly ada wound, ada skin breach, so we don't suggest use minyak gamat. Kalau macam just kena cubit merah tak ada wound, then nak sapu minyak gamat je lah, biasalah takut dah sakit boleh rakut. Kalau provided no obvious skin breach, sebab anything yang dah ada skin breach tu is actually you kena extra cautious lah. Sebab you tak nak, bila you tahu dah ada skin breach, maknanya barrier tu dah you dah okay, dah terbuka. So jadi please don't introduce something yes yang you tak nak, macam you tiba-tiba masuk kan, we don't want that.
Because Next question. I think this is not just Our next question is, and I've tried this before. That's good, but toothpaste can shrink pimples. I feel this quite a lot.
I heard about this, but
Picture nama tadi.
if you ask me, can toothpaste shrink pimples? Yes.
Jangan kena jawab dulu ke tak ya?
Well, excited.
Alright.
Right.
Dia pandang.
Alright. Okay,
Yeah.
ready? 3, 2, 1. There's a little fat.
Ya, ada face dia.
Okay, okay.
Okay, it's a bit with some pinch of salt.
Okay, okay. Wow, I'm just thinking about this one.
Okay, alright. So, toothpaste on the skin. First, toothpaste is not meant to be put on the skin. Remember we talked about how you have to, you know, your how delicate your skin barrier is. Putting a toothpaste on the skin put you at risk of getting contact dermatitis. And contact dermatitis can also sometimes mimic acne form eruption. They can present with pustule, can present with inflammatory papules. I mean the red bumps, the pustule, you know, the bisi-bisi darah kecil yang ada. Okay, so you don't want to put something that is not meant on the skin on the skin. Okay, that's one thing. Second thing, when we talk about, you mentioned you put some toothpaste and your acne shrink. Okay, so acne can shrink even if you don't put anything.
Oh.
Yeah, you know, the issue is not about shrinking. Acne will resolve, but the scar that it leaves. Okay, so you treat acne because you want to prevent the scar. Because when the scar forms, it's very, very expensive to treat the scar. And it's very difficult to treat the scar. You know, so that's why, I mean, you never, tak pernah kan jumpa orang yang macam, you know, satu acne tu sentiasa je ada tak hilang-hilang kan. At some point dia akan hilang. At some point dia akan hilang. You tak tahu apa-apa pun, some point dia akan hilang. But the longer you leave it on, dekat sana, the higher the risk of getting scar. So same like putting toothpaste on your acne, you put a risk of you know, creating more inflammation around the area, higher risk of scar. So please don't put toothpaste on your skin, on your face. Okay? Toothpaste is only meant for your face. Hence the name.
Nanti dia punya acne putih.
Like just kidding.
Okay. Alright, so next for the next question. Okay. Steroid cream works fast, so is it good for everything?
Okay, this was for me. Yes, I love the question.
Okay, right.
Okay. So steroid, oh, okay.
Very excited.
So again, repeat back the question.
Alright, steroid creams work very fast. So is it good for every skin?
Skin infection.
Sorry, but it says it for everything.
For every skin condition.
Skin conditions, yes. Alright, ready? Okay. 3, 2, 1. Oh, it's a myth. Okay.
So steroid is good. Yes, it's good. Okay, but can it be used for all types of skin condition? No, you cannot. You know, having a good tool on a wrong situation, wrong hands, it become a bad tool. Okay, for example, simple lah. Again, because kita dekat Kemaskar kan.
Okay.
We just talk about pegang senapang lah kan. You know, like maybe the latest weapon. Senapang yang paling latest kan. Yang memang sekali tembak ramai orang boleh pakai. So in a good hand, in a correct situation, it is a good thing. But in a wrong situation, wrong hand, it become a bad thing. Same like steroids. Okay, so steroid is a good medication. It's a wonder drug. That's why steroid stays sampai sekarang. There is still a role of steroid in some of the disease. You know, tak boleh buang hakikat. But you be selective with what disease, what skin problem that you use steroid, and you really have to know your weapon through and through. You know, you're gonna tahu steroid punya how it works. You know what are the potential adverse effect, where to use, how to use, in order that so that you don't get the side effect or the complication of steroid. Yeah. So the answer is not for all skin infection. For infection, we do use. Because we are under the theme of cutaneous infection, so cutaneous infection we used to work for inflammation. Yeah.
So these right tools at the right time,
Yeah.
the right situations.
Yeah.
All right. So we go first the next question. So the next question is, daily antibacterial soap prevent skin infection.
Antibacterial. Ini question daily antibacterial soap. As in your showers ke daily shower?
Yes. We have
I don't think you need to mention the
sorry. Okay.
DT,
Yes.
KT.
Okay.
It's very specific.
Okay, I think you can bleed that out during the post edit. All right. So ready? Okay. 3, 2, 1. Smooth. Alright.
Okay, so I tambah sikit. So I rasa the big answer dermatologist like just why I just nak tambah sikit, nak add on sikit. Why? Because kalau ayat tu prevent skin infection, so definitely not. Because antibacterial soap macam dia lah, you tahu your skin barrier, all the factors yang my sister has mentioned just now. So jadi kalau you kacau the ecosystem, antibacterial maknanya you akan you overdo removing all the good bacteria pun, so jadi nanti you akan lost your first physical barrier. Macam maksudnya you akan lost the good bacteria yang you tak you akan lost the protection by the good bacteria. Itu sendiri akan jadi risk factor. It's not lah directly, tapi dia akan jadi risk factor untuk you introduce, menyebabkan skin you maybe jadi makin nipis. So akan jadi risk factor untuk senang lah dapat tergurih sikit je dah ni. Sebab sekarang ni antibacterial soap tu kan tu dia ada chemical yang akan still macam dia takut mengering, terlalu drying your skin. So it definitely won't be good to maintain your skin integrity. Sebab sekarang ni we are talking about preventing skin infection. You nak prevent, just Dr. Mun mention, you just wash dengan water je lah. Water ataupun normal soap. So sabun nenek you pakai semua tu actually is a good sabun actually.
It's good enough.
Yes. Okay. So dia tak payahlah antibacterial. Boleh antibacterial, tapi maybe kalau you obviously memang dah contaminated ada, then use antibacterial lah. Macam memang you dah terkena baru lepas pegang cuci bersihkan sampah ke, cuci stool apa benda kan, you nampak clearly contaminated area, then okay. Tapi kalau you just nak mandi biasa, then the normal soap, tak payah antibacterial soap spesifik pun is okay dah, good enough dah. But the thing about commercial soap semua ni, they don't talk about the good thing, yang ada benda yang dia orang tak beritahu. Macam tu lah actually. Kan, betul tak?
I agree. I mean, most of the antibacterial soap is quite harsh on the skin. They're gonna damage the skin barrier, and the damaged skin barrier is the reason why you are more prone to get infection. You know, it's not to say not to use an antibacterial or antiseptic wash. It still has a role, but not to be used every day untuk orang yang tak ada masalah, or just to prevent skin infection. We do sometimes use, for example, in the kids, pesakit yang ada atopic dermatitis, sometimes they have they have higher risk of staph colonization, and if they have very recurrent infections, kejap skin bacteria infections, kejap skin bacteria infection, and you also know that with staph aureus colonization, your AD, your eczema is more difficult to control. And these kind of cases, we do sometimes prescribe them antiseptic wash, but it's only once a week. It's not to be used every day, because if you use it every day, your skin will be very dry, then you damage the barrier. Okay, so, and again, some of the OT, especially kalau nak buat dekat high risk area, they do use antiseptic wash, bagi patient mandi dulu satu badan dengan antiseptic wash, plus OT, dan clean dekat area. So, once in a while, in a correct setting, ada lagi role, but not to be used every day, kena guna antibacterial soap because you want to prevent infection.
So that's also normal soap is just okay.
Yes.
Or just wash with water. Situation where you need and feel that you need that, then you do.
So kalau mandi you balik daripada main sport, of course you can do something. Kan you sabun sikit and then water. But it's not necessarily kena pakai antibacterial. So, kalau memang you baru lepas deal with something at the tea, nah, just hand wash a little bit, tak ada masalah, but not to be used every day when your body is, because you want to prevent skin infection.
Now we move to the next question. I think this question, we all experience it. Okay. Is it safe to pop pimples?
For pimples
Is it safe to pop pimples?
Is it safe? You learn about skin infections, right? Is it possible?
Okay.
Is it good?
So the question is it safe to pop pimple? Like that?
Yeah, it is safe.
The answer is supposed to be yes or no, right?
Yeah.
Or not myth or fact, right? Because it's not a statement.
Okay, for this one we go with yes or no.
Okay.
Alright? Okay.
Itu mengarah.
You're gonna say is it a myth or a fact if it is a statement, but this is like a question.
This is for the question. Yeah. So let's go for the yes or no.
Yes or no lah.
Is it safe? Is it pop pimple?
Alright, ready? Okay, 3, 2, 1. No! Okay. Why is it? Why is it not safe to pop pimples? It's like a lot of people out there are always popping their pimples.
Okay. If you love your skin, you don't want to have a scar, then don't pop your pimple. You know, we're talking about safe here, not safe mati. Of course no, you know. But if you tak nak, because we talk about acne, this sequelae of acne, scar, you don't want scar, you want to prevent scar, then popping a pimple is not a solution to prevent scar. It's actually give you a higher risk of getting scar, and popping a pimple also pose a higher risk of getting a cutaneous infection. Because you know your hands, God knows where you put your hand, you toilet ke apa ke, ataupun dalam toilet bagi lepas buat apa, suddenly nak buat pimple, then pop pimple. So you know it's not easy, it's not safe. Yeah.
Satu lagi especially dekat area itu kan kita ada triangle.
Yeah, the danger or
triangle. Yes. Biasanya kata jenis yang kalau pimple ke area sini, because sini banyak capillary that directly connected dengan you punya blood vessel dekat brain. So kalau memang it is actually what we suggest is please avoid popping your pimples.
So what should we do?
If you have pimples, I mean, you know that they have this patch.
Medication.
Right? So the pimple patch is actually to prevent you from popping it.
Oh, okay.
You know, the pimple patch is not to be used. The acne terus letak pun berhari-hari kat situ dan okay, the pimple patch is help in a way that it reduce the risk of your hands going through your face towards the pimple and you know like doing something to it and causing problem. You know, so use acne medication. You know, you have lots of acne medication. You can use benzoyl peroxide as a spot treatment. You can use lactic acid as a spot treatment. But you want
If you know how many bacteria actually present dekat sini, and then when you still want to popping your pimples, then you akan please entahlah.
Think twice.
Ya, you akan fikir banyak macam betul ke kalau lah Tuhan bagi you nampak banyak bakteria, you letak, dan actually bila popping tu kita kan breaching the skin juga kan. So jadi yes, so jadi macam you through dia macam masuk, okay, dia pun elok je. Macam tu. So jadi please don't lah. Okay.
Alright then. So we have 2 more questions.
Okay.
So next question. Makeup causes skin infection.
Makeup causes skin infection. You're talking about Sephora's makeup or drugstore makeup? No lah, just
makeup can cause skin infection. Can
ke atau makeup can
makeup cause.
Can.
But it can.
Can cost ke kata cost?
Because if makeup itself costs information, but makeup can.
Dia macam
What's the incident?
So the question
yes.
Can or
makeup can cause skin infection ke atau makeup cause skin infection?
Makeup can cause.
So mana nak tahu fact atau myth kan?
Right. Okay. Okay. 3, 2, 1. Facts.
okay. But remember, the word can. It's not that makeup causes infection. No, makeup can. Yes, on a certain condition, especially when. I mean, I actually have a patient who has erysipelas of the face, infection. It's like a sentence. It's like a cellulitis, but more superficial. And it's because she never washed her brush, her makeup brush. She never washed it. So she has been using for many years because she has some pigmentation problem. Never wash it, pakai every day, and one fine day, infection. So yes, if you're not hygienic enough, so always wash. It's like putting your hands, tak masuk tangan langsung. Would you do that? Right? Yeah. So the key is to wear correctly. Yeah.
And especially macam contaminated makeup ke apa yang kita tak nak kan. And biasanya macam like macam saya cakap is the tools. You remember ada in 2017 ada kes Sephora kena bingsu. Yes. Tapi dia kata the tester lipstick kan. But still maksudnya because of not the makeup itself, it's actually the tools. Maksudnya ataupun maybe makeup tu yang dah orang lain pakai because certain skin infection dia ialah you can sit on the makeup itself. So jadi dia akan act as a carrier. So, jadi yang tu pakai, yang ni pun pakai, dapat infection.
So it's the unhygienic use of makeup, not makeup itself, but the unhygienic use of makeup. Like macam sharing makeup. For example, Sephora, you have, not to say brands again, anywhere you went to the makeup stores when they have the tester, and everybody will putting, for example, lipstick. Everybody will putting on the lipstick. Lepas orang A, B, and then C, and then D. God knows, maybe B baru lepas kena habis cold salt, then dapat dekat, we're gonna get you're gonna transmit the infection more likely that way. So it's the unhygienic use of makeup.
My advice is bila I dah start belajar time I medical student, I dah tahu kita we learn about this kan. Tak adalah lain-lain terus tahu, no, tak ada. But when we learn about this, I pergi dalam store ke, I pergi mana-mana nak try lipstick apa, I try kat tangan. You never try it on your own lips. Please don't. Okay, you have no idea how many people previously have been tested the same lipstick. Betul tak? Tentang orang tu, satu kalau pulsor yang bernasib malang lah. Kalau just yang jenis tak tahu ini dia dah pakai apa sebelum ni, we don't know kan. It's not about being kita ni pembersihan, no, tapi this is about taking care of ourselves. Kita tahu it can be transmitted. So jadi kita nak, dia bukanlah 100% definitely you dapat, it's a risk. We are talking about risk. So jadi you just pakai kat tangan, and then lepas tu you just like tengok warna dia, then okay lah. Macam tak payah beri nak try macam tu, no. Dia macam it's actually macam satu risk factor lah. It's not directly, definitely you will get, no, tak adalah macam tu. Okay, so just berjaga-jaga, langkah berjaga-jaga. Maybe as a man you tak pakai lipstick, tapi you nak nasihat you punya kawan-kawan nanti just pakai kat tangan je lah kalau nak try lipstick. Be on the safe side. This is when you are talking about makeup lah.
That's why I see a lot of my sisters, and every time they go to Sephora, they will have like a colour palette on their
Yes, I pun sama. Saya ni tengok-tengok tukar semua. Balik nanti sebab tanya, kenapa merah ni awak dia nak try.
Alright, then okay, that's a very good one. Okay, now for the last one, skin question. Right, only married, sexually active people get herpes.
Only married.
Yes, only married or sexually active people get herpes.
So, is it a myth or a fact?
Yes. Okay. So it's a myth. Why is it a myth?
Because you can get herpes simply, you know, you have two types of herpes symptoms, right? You have HSV1 and HSV2. You know, HSV1 is more common. You know, over your oral cavity, you know, your cold sores, you know, the common, that is HSV1, you know. Although you can also get some HSV1 down below, but or HSV2 above, but it's mainly is HSV1 is above, HSV2 is your genital herpes, okay. So even kissing, you know, for example, to baby, when you will transmit, let's say if you have cold sore, you will transmit the herpes to the baby. That's why orang cakap, oh jangan cium baby orang macam tu saja. So not necessarily have to be sexually active to get herpes infection, because we have to do this. And the first HSV1, you can be transmitted through oral, close contact oral transmission.
And somehow nowadays, you know, you can get sexually active without being married. Kan? So not necessarily marital couple will get. So jadi it's not about being married or not. It's like, say, apa, are you sexually active or not? And if you are talking about herpes simplex, HSV2, yes, it's more of a sexually transmitted. HSV1, more of a, it's a cold sore. Usually it's a close contact. However, because of as we evolve, all the virus also evolve. So yes, nowadays scientists have proven HSV1 can also through sexually abnormal sexual activity lah, like what all this generation have been practicing nowadays. So yes, it's a myth. Jadi not just marital couple, as long as you are sexually active, then you have a risk. You have a risk, not necessarily 100%. You know,
And HSV1 not necessarily from sexual activity.
yes.
So that's our end question for this item. Fact. So I would like to ask you to remind yourself. Is there any microbiome myth or dermatological myth aside from today that you'd like to address?
Biomedic kan. Okay. Sama je lah, I think. With that, I want to
About
correct.
skin infection.
Okay, from my point of view, like I mentioned just now, maybe most of you think sanitizer is always better.
Yes.
No, actually, if you have water and soap beside you, then and your hand is clearly contaminated, then please use water and soap to clean your hand instead of using sanitizer. Because definitely water and soap, you can clearly remove all the soil and dirt, and in fact all the pathogen and bacteria, and especially in fact virus, in envelope virus, the normal soap can directly inactivate all the envelope virus. So jadi please instead of over sanitizing yourself, whenever you see your hand is contaminated, please use water and soap.
Okay, I mean, because I was thinking something along the umbrella of infection, right? So, I would say, doesn't mean that having cutaneous infection means that you are a dirty person or unhygienic person. That's not what it's saying. So that is a myth. Okay? So you can be very, very hygienic people, mask tangan kerap and everything, you still can get cutaneous infection. So we talk about skin barrier tadi, and skin barrier is not as simple as physical barriers. So there is a lot of other comorbidities yang play an important role. For example, you have diabetes, ataupun you jenis yang sweats a lot, so you have a lot of area very moist. And again, the innate immunity. Some people, they are just more prone to get cutaneous infection compared to the other, because the innate immunity, is what you are born with from your ancestor, kan? So doesn't mean that kalau dia tu ada jangkitan kulit dan you mesti dia
So we must that stigma.
yeah.
Like we always see people that have skin infection. Oh my god, this person must not that. So it's not. It's actually a myth.
Yeah.
Alright. Okay.
It's just like any type of infection. Doesn't mean that you're more you tutup kan, so like that. Okay, so you treat skin infections just like any other infection.
Alright, with that we finished for our segment for common myths and facts. So we will be going towards rest first, and then we can continue after this.
Alright.
Thank you very much. So now we're back from the resting. So we're gonna move towards our next segment, real or reels. So what we're gonna do is we're gonna show a few clips from movies, sci-fi movies, and whether or not is it possible to happen in real life. Okay, can we see the videos? Alright. So this is from Cabin Fever.
It's in the water. It's in the water. It's in the fucking water. Don't drink the water! It's in the water!
So brief context regarding the movie itself, Cabin Fever. Basically, it says that the lake itself, there's multiple dead bodies, and what happens is when the main character or the characters themselves drink the water, they start to get infected and causing all of those rashes and all of those bleedings. So, is it possible in real life setting where if one water source is infected, contaminated, the whole place could also get infected?
From what I tengok, aku nampak is it they are talking about flesh eating bacteria?
Yeah, yes.
Oh, okay. So basically, in real life, we have in our real life, the flesh eating bacteria usually it is not transmitted by fecal oral drinking water. It's not orally. I mean, like the transmission is not through you drink the contaminated water. Because God has created a very beautiful physiology. We have a good acid stomach to prevent. Whenever you eat something contaminated, your first human defense, your normal body defense, the acid hydrochloric will kill all the unwanted pathogen. And then the flesh eating bacteria usually transmitted by the skin contact, any skin breach. So the most top three, if I still remember, we have especially kalau in the lake water, kita ada macam Vibrio bifidus. Then next is Strep pyogen, and another one if one thing Clostridium, one of the species. So jadi basically semua tu it is not transmitted dengan you drink contaminated water lah. So jadi that daripada cara dia menyampaikan movie tu, first myth dia is the wrong transmission. So insyaAllah don't worry, in real life, provided you don't drink for you to get the flesh eating bacteria skin infection, it will not transmitted by you drink the contaminated lake water. Okay. However, if you have a skin breach on your food, if for example, and you dip you touch your feet, you rendam kaki ke dalam lake ke apa ke yang ada that particular bacteria, then yes, you will get not 100% you are at high risk of getting the skin infection, especially kalau macam badan ni memang dah ada low immune response. Because I have a patient yang diabetes dapat Vibrio bifidus dekat kaki dia sebab dia pergi, if I'm not mistaken, dia nelayan kot, dia tangkap ikan. So memang kaki dia ada luka, and then you are exposing yourself to the particular bacteria. So dia masuk through the portal of entry is through the skin breach. So jadi then yes, you will get the presentation is typical redness, tapi dia bukanlah terlalu cepat yang no. Why the skin tu merah? Because the immune response. Because bila kita tahu bacteria tu multiply, invade the skin, multiply, induce your immune response. The immune response semua tu akan start shut down your blood capillary semua, sebab tu dia nampak merah, hitam macam tu. So bukanlah dia macam you minum start daripada, I sendiri pun tak nampak, pernah ke nampak so dia merah daripada sini. I tak pernah nampak lah in reality-nya, but daripada movie tu I think maybe they are talking about flash-eating bacteria, so that is now it is transmitted lah. So insyaAllah dah jaga diri, jangan pergi dekat-dekat lake. Lepas tu lake yang you rasa contaminated, foto, jangan simply, kalau kaki ada luka, don't simply swim dalam situ lah.
Okay. Yeah, again, if you talk about flesh-eating bacteria, then you have habitats on the skin and contact with the contaminated area. Yes, you can, you know, macam askar kan, so you masuk hutan, you have lots of types of organisms. Yeah, you are at risk of getting hepatitis and bursitis. Okay, so that's one thing. And you talk about skin melting away. Okay, so there is an infection with Staph aureus. Staph aureus is one bacteria that can produce this, what we call as exotoxin. And what this exotoxin is a type of exfoliating toxin. And what exfoliating toxin does is that it cuts off the protein that holds your skin cells together. So when your skin cell get loose, then you get sort of like skin peeling off, exposing the lower part of the second layer of the skin, which is cutaneous. That is what we call as Staphylococcus aureus skin syndrome. Okay, and one thing about Staphylococcus aureus skin syndrome is that the portal of entry is not necessarily directly from the skin. It can be because of secondary bacteria from elsewhere. Last time there is one case of Staphylococcus aureus skin syndrome in adult, where this one particular female wear a tampon and she actually forget to remove the tampon. So from there, bacteria, Staphylococcus aureus skin syndrome. Okay, but not like that one transmission. Drinking contaminated water. So it's actually, they put something
make it more dramatic. Yes, yeah. Right. Okay, thank you very much. So it makes me feel relieved to know that if I were to go, because I go to training sometimes, or go hiking, we go to drink the water from the rivers themselves. So it's not a risk, okay, for me to.
But if you drink the contaminated water, you won't get the skin infection, but you will get other infection such as leptospirosis.
Okay.
So still the take home message is don't drink contaminated water, because even though you won't get skin infection, you will get other infection.
Alright.
Maybe either life-threatening infection, because leptospirosis can still kill. So still, whenever you are, kalau you want to drink, then drink proper boiled water, unless you are in area yang memang air dia very macam spring water. Macam kalau kat Europe, most of the country you boleh drink tap water kan directly. Tapi kalau macam kat area kita, our locality, memang you cannot drink directly from the lake ke apa, because kita takut dia contaminated dengan ada bakteria yang banyak kat situ. Tapi if you are talking about skin infection, the portal of entry, like my sister mentioned lah, is either you memang ada secondary dah ada sauce dekat dalam badan, ataupun you need a skin breach. Sebab kalau you drink contaminated water, you akan dapat infection lain lah. Kita panggil fecal-oral punya transmission. Definitely it's a different infection. Still, please don't drink contaminated water.
I'll take that in mind whenever I go hiking or going for a trip, alright?
Yes.
So now we move on to our second reel or reels, and it's a movie about fungal.
Children, they present as children. You know my opinion on that.
That the pathogen, the fungus, does their thinking for them.
Security detail, go.
Should we bust down?
No. Drop the shutters.
There's a cranial strap on the left.
I'm not going to cut around a cranial strap.
Do you want to redose her?
Yes, Jane. That would be extremely helpful.
So with context regarding this scene.
It's truly a zombie movie. I don't see any fungus there.
Alright, but the brief context regarding for the Synapse is that the main pathogen is coming from a fungal species that is able to infect humans and somewhat mind control them and bring them to a frenzy state. Is it possible for that? Because we've seen in National Geographic that there are certain type of fungus that can cause this type of effects on ants. So we're kind of concerned, is it possible for humans?
Okay, dia macam it is possible. Is it possible for human? Okay, as far as I know, insyaAllah not possible lah. But is it biologically possible? Biologically, you're talking about all the human, all the living things. Because yes, I've read somewhere there is certain fungus, I forgot the name. Yes, it can. This specific fungus has been evolved from previous million years ago, and yes, it can only specifically infect ants because dia punya all the sebab kita fungus ni is an eukaryotic and kita kan prokaryote, so jadi dia punya tu match dengan ants, so dia boleh invade and taking control of all the ant punya system, the whole system. Kalau as in human, kita tahu we have first fungus nak infect dia kena cross blood-brain barrier, and there are specific fungus nak cross blood-brain barrier macam cryptococcus ke apa, tapi dia not taking control of our nervous system. If you have kalau if our brain has been infected by the particular fungus and we are behaving abnormally, it's not because of the fungus itself, it's because all the human kita punya brain tu kan, nervous system, the electrical impulse, all the activity brain menyebabkan we are behaving different. Tapi sebab sekarang ni, and then scientists also what they have mentioned, I still remember what I've read previously, that particular fungus, it actually cannot survive in normal human temperature. Kita punya body temperature is 37 kan, and then plus ada factors yang tak tally, cannot match. So insyaAllah, God willing, it will not invade and taking control of our nervous system like what it did to ants. Yang ants tu yes, but itu they say berjuta-juta tahun memang dia dah evolve. Specifically dia pergi dekat ants sahajalah. Untuk movie ni kau tak nampak pula ada fungus pergi dekat ni kan. Tapi still kalau kita tu boleh still please don't have fungus. Suddenly
just go to the forest.
Yes, memang kita tahu kalau cendawan is also kita panggil fungus kan. Ada cendawan boleh makan, ada yang tak boleh because beracun, but not because it will invade our nervous system. No, insyaAllah not lah. InsyaAllah, because we don't know what will happen in the future kan. Okay.
So in terms of any skin infections or pathogens that can cause some sort of delusional or any sort of
Any kind of substance can cause delusion. Can cause abnormal behavior. So any kind of substance. Okay, sometimes you can get infection of the brain, your meningelia, encephalitis, your meningitis, encephalitis. So you can present with abnormal behavior. Okay, and anything that raises your intracranial pressure, for example, in case of infection, it causes a raise in ICP, then you can also present with headache and also abnormal behavior. Okay, but the abnormal behavior is not directly due to the bacteria or the virus. It's more of like the effect of the infection of the body. Alright. So definitely not like a zombie, right? The abnormal behavior make you, somewhat erratic. You can, climb up the bed, tak pakai baju, bila bercakap mereka, but not intimate.
not intimate. Alright. Okay, that's a big relief to know that this type of things won't happen, inshallah. Alright then. So now we can move towards our next segment, prevention and best practices. So, as you all know, prevention is better than cure. What advice can you give to our listeners to reduce the risk of skin infections?
For me? So, to reduce the risk of skin infection, first is maintain your barrier. You have to have a good barrier integrity. Okay, so how to maintain your barrier? Avoid something that is so harsh on your skin that can damage the barrier. Use lots of moisturizer, to sort of like support your barrier. And then, some of the infection is because of the immune host itself, So when you are on the immunosuppressive drugs, or you have diabetes, so you have a relative immunosuppression, or elderly, sometimes relative immunosuppression, that can also predispose you to get infection. But that one is, out of your control.
Yes.
But what you can do on your side is, to take care of your health. Make sure you don't jeopardize your health rates, like prevent diabetes, healthy diet, to maintain the immune system, that's all. But on skin part, maintain a healthy barrier instead. So avoid harsh product, moisturize your skin, always check your food. For example, if you are at prone individual, for example, you pakai kasut normal because it's askar kan, and then you wear socks, and then you buat kerja yang memang banyak sweats, and you're gonna get lots of macerated in between your toes. So what you do is make sure that area is dries up, make sure the area yang ada skin breach, you check if tak ada secondary infection dekat situ, and keringkan that area. As simple as that. So keep a good healthy barrier. That's all.
So, is there any vaccines that can prevent skin infections that we should know of?
Yeah. So vaccines is generally for viral. For skin infection, in case of viral, you can get genital warts. And some of the genital wart, the high oncogenic strain, can give rise to cervical cancer. So we have HPV vaccination because most of them, all your genital warts are virus. So now you get HPV vaccination. So make sure you get your HPV vaccination. It reduces the risk of cervical cancer. And if you get the 9-valent one, the one that cover 9 variants, then it can also reduce the risk of getting genital warts. So that's one. Okay. And then the other vaccination, have you heard about shingles?
Yes.
Okay. So shingles also have vaccinations. So those who were not going to chickenpox during the younger years, when you get older, you have a risk of getting shingles. Kayak in Malay bahasa lah. So we have a vaccination for kayak, for shingles, and this vaccination is reserved for those who are relatively immunosuppressed. Orang yang dah berumur more than 50 years old, because why you get back that shingles is because of the relative immunosuppression. That's why your virus, the Picardia virus, your varicella virus yang dah remain dormant dekat your nerve root, they keluar balik and cause shingles. So that's why those yang at risk, you can get shingle vaccination. More than 50 years old, other comorbidities, diabetes, COPD, then you can get shingle vaccination. Or also, even if you are on certain medication that suppress the immune system, suppress your immunity to fight off the virus, you are also advisable to take that shingle vaccination. Other than that, if you talk about cutaneous infection, you talk about chickenpox. Yeah, chickenpox also we have vaccination nowadays. You can vaccinate your child for chickenpox. I think that's about it. Maybe for viral, or if you talk about prevention of infection. Yeah.
So in terms of in a hospital setting, for antibiotics, what do we need to know about for sort of skin infections? Is there any importance in it?
So antibiotic to prevent skin infection.
You are specialized in antimicrobials, right?
So basically sebenarnya if you are talking about antibiotics, right, exactly it's not directly linked dengan any skin infection lah, unless macam you are allergic dengan certain antibiotic, then it will present like macam ada rash ke, but still kita lah kata tu skin infection, still dia macam maybe is an allergic reaction. Tapi itulah what I can advise about antibiotic is like in hospital setting, we don't advise usage of unnecessarily broad spectrum of antibiotic lah, because like I said, kita treat kita punya skin ni macam as a satu ekosistem, is a green forest. You punya skin ada dia punya normal flora, your gastrointestinal tract pun ada dia punya normal flora. So jadi bila you take unnecessary, contoh specifically intravenous broad spectrum antibiotic, kalau you get rid of the good bacteria inside your GI, so nanti dia akan start ada abnormality in the proportion of the population, bacteria good, bacteria bad, bacteria apa semua. So yang bad bacteria tu akan overgrow, dia akan naik and cause certain infection, not necessarily skin infection. So jadi anywhere kat mana-mana pun, even if we are not talking about skin infection, unnecessary usage of broad spectrum antibiotic is not advisable lah. And satu lagi, kalau skin infection, not almost equal to oral antibiotic, betul tak? Maksudnya sometimes you just need a topical, kan? You tak perlukan pun semua skin infection semua pun kena makan, no. Maybe that's why you need to see a proper doctor. Kata kalau good enough dengan topical antibacterial cream ke apa, then good enough. Unless kalau severe infection, yes, definitely. Kalau severe skin infection, yes, you need an oral antibiotic or in fact intravenous antibiotic, then untuk treat the infection lah. So kita tahu, and then because yes, the doctors and specifically dermatologists tahu when to start. Okay, this is indicated for oral, then you start oral. Kalau just a very mild apa topical cream, fusidic acid apa, then it's okay lah, no need to start oral antibiotic, kan?
I mean, generally you don't use antibiotic to prevent infection. You only use antibiotic to treat the infection. So if there is no infection, don't use antibiotic just to prevent infection. You're using it in the wrong way, you're creating more problems because it's a problem. You're killing off species that is supposed to be protecting against other species. You know, for example, if you talk about antibiotic, and you talk about skin microbiota, a long duration of antibiotic, which we commonly use in acne, and the purpose is not for antibacterial, it's actually for anti-inflammatory. That's why only certain antibiotic is used to treat acne. Alright. So, but in that case also, there is also a risk of killing off, you know, the other good bacteria, and because of that, you can get overdose of yeast. That's why you can get fungal folliculitis. So that's why, you know, first, antibiotic is not for preventing an infection, it's only to treat infection. If you have infection, then you give antibiotic. No infection, just colonization, no need to give antibiotics. That's one thing. Second thing is, please use something that is just to target that particular infection only, and not to, because it's very important to maintain the ecosystem. If you want species, get another different species. Yeah.
Very much. So what you can get here is that to prevent, we need to maintain a very good balance between our own sanitation, our own lifestyle and cleansing. Like Dr. said, we can just use water just to wash our hands, and also only use needed for antibacterial when it is needed. And for antibiotics, we try to not overuse it and use the right antibiotics whenever for the right one, and use it as a treatment rather than prevention. Alright. So now we move on to our next segment. Interesting cases and stories. So can you share any memorable cases that taught you something unexpected about skin infections?
Something unexpected about skin infection. Like I mentioned just now, I've got a patient who got Vibrio infection from a skin breach. Because usually what we have learned in medical school, Vibrio is usually related to, in Malay kita panggil taun, kan, cholera. So I have a patient who get Vibrio cholera skin infection from because this patient definitely, okay, one thing I have to tell you, okay, this patient has underlying autoimmune disease. So definitely one of the she has one of the, dah lost one of the very, macam mana dia ada immune dia predisposed to certain infection lah. So jadi bila dia pergi berkebun dekat belakang rumah sahaja, suddenly dia punya her skin dia tak ada skin break tapi dia pierce, dia tak ada luka yang sedia ada, dapat luka baru after one of the ranting kayu dekat atas tanah breaking her skin dekat leg ni. And then suddenly walaupun the bacteria is Vibrio cholera, she didn't have any of the diarrhea symptoms, semua tak ada, just presented dengan redness, a very bullous reddish skin. So, jadi datang, yes, they treated orthopedic, treated the patient as bullous cellulitis. Then culture send, bila dapat Vibrio cholera, in fact culture from the from the blood and also from the tissue, because all the infectious disease physician pun pelik, why tak ada symptom kan. So jadi maybe it's likely as a microbiologist, I did call IMR to discuss, maybe this particular Vibrio cholera strain, they didn't have the toxin that cause the specific diarrhea, because all the bacteria ni nak cause symptom dia kena ada specific virulence all the gene. So maybe betul nama dia Vibrio cholera tapi dia tak ada particular toxin gene yang cause the diarrhea symptom. So they only presented dengan redness skin infection. So jadi memang kita treat dia sama, antibiotik. So this is the case where you use a proper antibiotic. About 2 weeks they give 10 days total duration of antibiotic intravenously was given. In fact memang kita check juga dengan stool dia 2 kali memang negatif for Vibrio cholera. Yes, sebenarnya memang dia tak ada carry dalam dia punya, yes, dia carry dalam blood dia bacteria because ada evidence of bacteremia, tapi dia tak ada datang dengan simptom medical. Yes. So jadi that is one of the skin infection that I still remember. Maksudnya walaupun you tahu this particular pathogen commonly cause skin infection, however in certain population macam yang ada a very immune, dia ada autoimmune disease yang menyebabkan dia prone for, kita panggil immunosuppressed, maybe certain bacteria biasa yang tak typically cause skin infection, they can present with this skin manifestation lah. I still remember that Vibrio cholera causing bullous cellulitis. I did publish the case, because it's an interesting case actually, because usually kita tahu Vibrio yang cause skin infection is Vibrio vulnificus, it's a different species, tapi ini Vibrio cholera. So yes, it's kind of, I still remember until now, walaupun dah 4 tahun lepas case lah. Yes.
I mean, just to, as a continuation, if you're dealing with an immunosuppressing individual, the presentation might be different from what you did, so you have to be more vigilant, so don't just herpes takkan buat this kind of big ulcers. Most likely this is different type of infection. In immunocompromised host, any type, even the infection that is not so prevalent also can be very prevalent, So those, the one that usually cause a very small fine ulcer also can become a very huge big ulcer. So you need more to diagnose. You might need your biopsy, you might need your culture, but you cannot just base on clinical judgment. Yeah, because in immunocompromised host, the presentation is really.
Was there any sort of interesting or unforgettable case that you have asked regarding your career?
I mean, same with regards to immunocompromised also. I mean, I've got lots of cases. It's just that the things that you ingat benda ni, but it didn't turn out benda lain. It's because of the how the presentation is. You belajar this kind of thing takkan present this bad, but in immunocompromised also can. So you have to do biopsy. For us, we have to do biopsy and send cultures, but very budget. Sebab they can come with anything. The cause can be meant by anything, and infection is always one of the things.
Jadi interesting untuk kita orang medical doctor. It's like my sister cakap, you ingat one thing tapi tak ingat tak boleh sebab ni, tapi rupanya boleh. Macam ada satu case juga yang datang dengan lesion chicken pox, maybe because bila chicken pox ni you manifested, you dapat time adult, it will be usually present as a severe infection, instead daripada kalau you baby ke budak kecil, adolescent selalunya dia akan self-limiting punya disease kan. Kalau adult selalunya ada risk untuk get further complication. Datang dengan chickenpox lesion, suddenly abnormal behavior, rupanya dah meningitis. Maknanya the virus has infect the brain. So jadi maksudnya just from the kita nampak macam chickenpox infection, tapi it can actually present dengan meningitis. Jadi kita ingatkan macam ni, tapi sebenarnya macam ni. So that is actually kind of interesting lah for any of us yang yelah, nanti maybe you pun anybody yang dah
interesting, this is more of like pengajaran. So that
yes.
if you're dealing with immunocompromised hosts,
things that you can learn macam
you have higher index of suspicion. Infection will always be one of your important differential to rule out, even though benda tu tak nampak macam takkanlah infection dulu buat macam kan.
Okay. So one thing saya selalu mention kan, in immunocompromised, everything under the sun is possible. Macam kalau you normal tak apa, okay, tak resik, tapi kalau you immunocompromised, so everything under the sun is possible lah.
So whenever we have a patient that think that is normal, we should always be vigilant regarding for any sort of like atypical cases.
I mean, kalau dia datang dengan you dengan normal, tak ada masalah, dia ada masalah lah. But kalau dia datang dengan, let's say ada satu benda masalah, and you don't just rule out infection very simply macam tu saja just because benda ni takkanlah sebabkan infection takkan buat tu macam tu. Because in immunocompromised hosts, infection can be manifested as more severe than even benda yang tak virulent pun boleh jadi virulent.
Benda yang tak serius untuk kita, tapi untuk diorang jadi over because of the suppression of the immune response. They have a very low defense mechanism kan, dia punya defense system tu dah tak kuat, so dia akan manifested dengan yang kita yang okay.
Quite interesting. I think this will be a very good lesson for everybody. Not just able by discovery, that always expect something else, especially for patients that have autoimmune or whatever. Alright. So now we move towards our last segment, take-home messages. So to wrap up, what are the top 3 things to our audience should remember about cutaneous infections?
Maksudnya anything lah. Top 3 macam biasalah, sama je ayam macam tadi akan nasihat, don't overdo. Okay, maknanya don't over sanitize your skin. Lepas tu treat because you all semua pun Gen Z suka green flag kan. Dia treat kita punya skin as a green forest. Dia ada ekosistem dia. Dia ada good bacteria, ada bad bacteria. So kenapa saya cakap don't overdo, don't overdo sampai you kill the good bacteria. Yes, you need juga the bad bacteria, tapi dia bad bacteria memang Tuhan jadikan in a very small proposition. So don't worry. So jadi itulah maknanya kita satu ekosistem lah. And then satu lagi top 3 yang kalau I sendiri pun what I practice is
top for prevention.
Satu dua benda. Satu lagi clean, maknanya kita whenever it is clearly contaminated, please wash your hand in the water and soap. Sanitizer kalau tak ada, tapi still kalau you nampak clearly contaminated, always wash, kita panggil moderately. Macam tu lah, back to the first one, don't overdo, don't over sanitize, don't over. Okay.
Let me just add on, the skin barrier, I think that's the only thing that you can have, because your immune system you cannot really control, If you have diabetes, then you have diabetes. What you can do is control the diabetes, but you cannot, make sure that I don't get diabetes, right? So, but one thing that you can control is your skin barrier, So, just do what's good for your skin barrier. Okay, so what we've talked before, dari segi macam mana nak bersihkan tangan, avoid harsh soap, avoid too fragrance with the soap, all this strong one you try and avoid. Of course, you have to wash your hands, but wash moderately, wash with what is adequate. If you are dealing with really dirty things or you're dealing with patient, yeah, sometimes you need to wash with some antiseptic wash. But after that, always moisturize your skin. You know, moisturize. That's another thing that you can do to help keep your barrier intact.
Yes, this is what she keep on mentioning whenever kalau kita orang balik ni balik kampung, after take your ablution for prayer and then dah basuh semua makeup apa kan, and then please wear your moisturizer, okay, and then maknanya lepas sembahyang dah duduk lepas sembahyang pakai moisturizer balik, then sunblock ke kalau dah siang. This is what she did pesan kat adik-beradik jugalah. Very good advice because yes, betul, when you have a very healthy skin barrier, then usually you akan less dapat, actually macam less juga dapat breakout skin ke apa ke, not just your face, in fact your tangan tu sama lah kan. Macam kalau you pergi kat climate yang cuaca sejuk kan, bila kulit kering kan senang luka, dan senang luka senang pula tiba-tiba dapat infection apa. So jadi just nak make sure tangan you tak kering supaya you tak breach the physical barrier, pakai moisturizer, tangan semua badan ni lah.
So now we reach towards the end of our podcast series, and I would like to say thank you to Aiman and Salamah for sharing your expertise and clarifying the facts from myths. So we hope this episode helps the listeners feel more informed and confident in understanding skin infections. So remember, knowledge is the first line of defense, and when in doubt, consult a professional. So to our audience, thank you for tuning into AMSA podcast series. Stay safe, stay healthy, and until next time, keep learning.
Good.